Triple feeding. I am Cindy Rubin. I am a pediatrician and breastfeeding medicine specialist in the Chicagoland area. So let's talk a little bit about triple feeding. You may have heard this term before. Sometimes people call it different things. Triple feeding is when you need to nurse your baby because you're intending to nurse your baby. So you nurse your baby for a full feeding, and then you offer your baby a bottle of either pumped breast milk or formula, fill them up with whatever you need to from the bottle, and then you need to pump to keep up your milk supply or bring in more milk. Because we do this sometimes when we're trying to bring up production, but oftentimes when babies, for one reason or another, are not either strong enough or able to get the milk out of the breast efficiently. And when that happens, they're not going to get enough milk if they don't get something by bottle, and they're not going to gain weight. And also, if your breasts aren't getting emptied to the amount that a baby needs, then your milk production is going to go down eventually as well. So you need to pump to keep the milk production up. Now imagine every 2 to 3 hours nursing, which may take 20 to 30 minutes by itself, then having to give your baby a bottle, then change your baby, put your baby down, whatever, and then have to pump for another 15, 20 minutes. That already took an hour at least. And then when are you supposed to eat or take a shower, go to the bathroom, or get your own rest? It is really hard to do this. And it should never be recommended without close follow-up and an endpoint in sight. So sometimes I will recommend this if a mom wants to do it. People can always say, no, that's too much for me. But I might recommend it for a few days or a week and then reevaluate to see, A, is that sustainable? And B, is it working? Because if your baby's not getting better at the breast, or your production is going down despite doing that, or there's other things going on, then maybe this needs to be looked at and something else needs to be tweaked. And you have to have a plan going forward that is sustainable. And this may be sustainable for a week, and after a week you may say there's no way I can do this anymore, or you may say actually I'm managing to do this. Or sometimes what you need to do is, if you need to make sure that you're emptying completely or your baby is taking more than they're able to get at the breast each time, then what you can do is, for at least some of the feedings throughout the day, just pump and give the bottle. And especially if you don't have an extra set of hands to do the bottle while you pump, then it might be more efficient and just make more sense for everyone to just pump and do the bottle those times, those feedings, which may be most of the feedings, or in the middle of the night you may want to do that, because it's just going to be quicker and more efficient. You take out that nursing part of things. And of course, your ultimate goal may be to nurse, and that's okay. I'm not saying to stop nursing, and you probably would want to at least do the nursing once or twice a day to keep your baby practicing and interested. But if you don't have an extra set of hands, or if you are getting overwhelmed by triple feeding, the next best thing to do will be mainly pumping, or substituting some of those nursing sessions with just pumping and giving the bottle. And then doing lots of skin to skin and snuggling and paste bottle feeding and other things, so that as time goes on and your baby gets stronger, hopefully you will be able to do more of that nursing and less of the pumping and bottle feeding. Hope that makes sense. I know this is complicated, and you should definitely be doing this with the help of a lactation professional or your pediatrician to help you to monitor it over time and reevaluate over time to see what needs to happen to make sure that your baby thrives and grows. Have a great day.